Healthcare is one of the fastest growing industries in the world, and Lehigh is looking to the future. According to the Bureau of Labor Statistics, employment in the healthcare field is projected to grow 16% over the next decade, adding about 2.6 million new jobs to the economy, more than any other field. The new Integrated Business and Health program prepares students to become leaders in this ever-growing industry. The four-year inter-college interdisciplinary program focuses on the combination of business principles and an in-depth knowledge of health and health policy, empowering graduates to thrive in the global health market. Healthcare is about helping people, but it's more than just treating patients. It's about supply chains, business management, finance, and technology. Lehigh's IBH program will train a new class of leadership in these fields and open the door to exciting career opportunities. The IBH integrated program brings the best of business and health together and prepares students to make an impact in a high-demand field.
So just want to welcome everyone to this session. I'm Beth Dolan, Dean of the College of Health. I'm excited that you all joined us today. This is our second session of a 6-session population health colloquium series, and the focus is the business of health. So this is the 7th colloquium series that the College of Health has hosted since the College of Health opened in 2020. Each of our series celebrates a milestone, an initiative, or a goal for our college. And of course, this colloquium series celebrates the new intercollegiate program, Integrated Business and Health, which is a collaboration between the colleges of business and health. The program welcomed its first cohort this semester, and several of the students are in attendance. So welcome to those students. We're excited you're here. If anybody missed our first session in this series, which was a conversation between Vince Ferlinza and Jeff Burbank about the company that Jeff founded, then served as CEO, he led, and then ultimately sold. That was a really interesting conversation, and it's available on the College of Health YouTube channel. So we also hope you'll join us for our next session after this one, which will be November 13th from 12 to 1:30. And the focus of that is translating discovery, insights from biotech and pharma leaders. It will feature Lehigh alumni, including Emily Windeen, Jeremy Smallsy, Jim Wassel, and Tom Anderson. So before we get started with today's session, which is focused on the future of aging, business, care, and community, I want to offer a few housekeeping notes. First, we invite you to enter questions into the Q&A tab on your screen at any time during the panel discussion. The moderator will get to them when it's time, but you're very welcome to just put them in when you're thinking of it. They often escape, if you don't write them down when you think of them first. We're celebrating a new program, and since we're celebrating the new program, we're going to try to answer student questions first. So students, if you wouldn't mind, please let us know that you're a student in the text of your question, otherwise we won't know. So I'm really excited today for everyone to meet one of the co-directors of the new Integrated Business and Health program, Ed Gomez. So in addition to serving as co-director of IBH, Dr. Gomez is professor in the Department of Population Health in the College of Health and director of the Institute of Health Policy and Politics. A political scientist by training, his research focuses on the politics of global health policy with a focus on emerging middle-income countries. He's the author of several books, with the latest titled Junk Food Politics: How Beverage and Fast Food Industries Are Reshaping Emerging Economies. Professor Gomez has published his research in a myriad of peer-reviewed journal articles, policy journals, and major news outlets. In 2022, Professor Gomez led the Lancet's first series on political science and global health and has led other major journal series. He's currently working on several research projects focused on the international and domestic policies of the commercial determinants of health, food security, and malnutrition. Professor Gomez was a commissioner for the Rockefeller Foundation and Boston University Commission on the Social Determinants of Health, and served as a national task force member on equity and COVID-19 for the Satcher Health Leadership Institute at Morehouse College. So the IBH program is in great hands. So Ed, I'll turn it over to you.
Thank you very much, Dean Dolan, and thank you everyone for joining us this afternoon. I have the honor of introducing the rest of the panelists. I'll start with Michael Guzmano. He is the Iacocca Chair, Professor of Health Policy, and Associate Dean for Academic Affairs in our College of Health here at Lehigh. He's also the Director of the Center for Ethics, Co-Director of the Health, Medicine, and Society program. Dr. Guzmano's research investigates the consequences of health social policy for poor and other vulnerable populations. He holds a PhD in political science from the University of Maryland at College Park and a master's in public policy from the State University of New York at Albany. He was also a postdoctoral fellow in the Robert Wood Johnson Foundation Scholars in Health Policy program at Yale University from 1995 to 1997. Next, we have the honor of Mr. Matt Lippitt joining us today. He is the Vice President and Division Director of Payer Contracting and Strategic Partnerships for Bayeda Home Health Care. Mr. Lippitt is the Vice President and Division Director of Payer Contracting and Strategic Partnerships at Bayeda Home Health Care, a 1.7 billion global industry leader with a clear strategic vision of home as the stable center of the healthcare continuum. Founded in Philadelphia in 1975, Bayeda provides nursing, rehabilitative, therapeutic, hospice, and assistance care services to children, adults, and seniors in the comfort of their homes. With hundreds of office locations throughout the US, as well as Germany, India, Ireland, New Zealand, and South Korea, Bayeda is a leading nonprofit home healthcare provider and the only national provider to offer a full range of home-based specialty care services. For the first time in home healthcare, Bayeda completed its transition from a privately held business to a nonprofit organization in January 2019, a decision by its founder and chairman, Mark Bayeda, to help ensure that the company would never be sold and that its mission, vision, beliefs, and core values of compassion, excellence, and reliability, codified in the Bayeda way, will endure for generations to come. Families and individuals coping with significant illness or disability need help and support, and it's Bayeda's mission to help people have a safe home life with comfort, independence, and dignity. Mr. Lippitt is passionate about designing and delivering services that enable clients to remain safely at home with maximum independence, while also demonstrating improved clinical and financial outcomes. He is responsible for the enterprise-wide managed Medicaid strategy and oversees payer negotiations across Bayeda practices. Mr. Lippitt joined Bayeda in 2017 as Director of Strategy and Value-Based Partnerships for the Assistive Care State Program practice, where he designed and successfully launched the practice's first value-based relationship. This initiative enables the most vulnerable and under-reserved community members to remain safely at home with maximum independence. This has led to reduced hospitalizations, readmissions, ER visits, and significant reduction in the total cost of care. Prior to Bayeda, Mr. Lippitt spent over 10 years working as a healthcare executive in New York City, where he focused on helping companies develop business strategies and design new products and services that deliver value to both care recipients and payers. He holds a bachelor's degree from Lehigh and a master's of health service administration from George Washington University. He resides in Warren Township, New Jersey, with his wife Marcy, son Max, daughters Jamie and Charlotte. Matt enjoys spending his time at the beach, fishing, skiing, and gardening. Next, we have Mr. Ken Fultacek. Ken is a healthcare entrepreneur, operator, investor, and advisor with a proven track record of building and scaling technology-driven healthcare businesses. He is currently the CEO of Mobile Health Management Services, a national provider of occupational health, wellness, and compliance services supporting over 400,000 caregivers and other essential workers across regulated industries. Under Ken's leadership, Mobile Health is focused on expansion of its service lines, investing in technology, and establishing itself as the market leader in employee health and compliance. Ken is also the co-founder of Care Connect, a workforce management platform designed to improve caregiver recruiting, engagement, and retention of caregivers, enhancing their overall work experience for providers and their essential employees. Previously, he served as president and COO of Sendata Technologies, where he led product expansion, grew market share, and executed the company's strategic growth plan, culminating in its successful acquisition of Excel KKR in 2019. Ken began his career as general counsel and COO of BAB Capital as an attorney at Catton, where he advised clients on M&A, private equity, securities, and general corporate matters. He serves on the board of directors for Preferred Care Home Health Services, a Florida-based home health agency, and the Sunrise Association, a nonprofit dedicated to bringing joy to children with cancer. He is also an active member of Young Presidents Organization. He holds a Juris Doctorate from Brooklyn Law School and a bachelor's degree from the University of Arizona. He resides in Port Washington, New York with his wife, Denise, and 2 daughters. And finally, we have Mr. Tony Wolk, president of ALW Consulting, LLC. Tony brings more than 30 years of experience in business, transactions, corporate development, and law. He is the president of ALW Consulting, LLC, where he advises small businesses, primarily in healthcare services, on mergers and acquisitions. Previously, Tony served as owner, chief financial officer, and head of development at Houseworks, LLC, one of the largest independent home care companies in the U.S., where he led its sale to private equity firm. Before that, he was a member of the executive leadership team at Universal American Corp., a Fortune 500 NYSE listed company providing health insurance and managed care services to seniors, which is required by WellCare. Earlier in his career, he held senior leadership roles as Continental Communications Corp., a NASDAQ-led telecommunications provider with more than $1 billion in revenue, culminating in its sale to AT&T, and was a corporate attorney in private practice at large international firms. Tony is a graduate of Lehigh and NYU School of Law and was recognized in 2006 as recipient of the New Jersey Biz 40 Under 40 Award. He currently serves on the board of trustees of Cooperman Barnabas Medical Center and Temple B'nai Jeshurun, and remains active in civic and community committees in Short Hills, Millburn, New Jersey. Thank you all for joining us. And I'll turn it over to Dr. Guzmano.
Well, thank you, Ed, and thanks to our panelists, and thanks very much to all the people who have joined us in this webinar and in the audience. It's great to be here. I'm really looking forward to the conversation we're about to have. Early in my career, I was lucky enough to be mentored by and work with Dr. Robert Butler. Dr. Butler, for those of you who don't know him, was the person who started the first Department of Geriatrics in the United States, and he was the founding director of the National Institute on Aging. And when I started working with him, he said, you know, you've made a great choice because aging is a growing business. And all of our panelists certainly know that. Just to give you one little fact about this, if you look at the projections for the population 85 and over in the United States between now and 2040, it's projected to more than double. So it is remarkable. So the incredible work that you've already heard about from our 3 panelists is highly relevant in today's economy. So I'm going to start with a fairly broad question for our panelists. I'll start with Ken, and then go to Matt, and then Tony. I'd love to have each of you just talk a little bit about your professional journey. How did you get where you are? When did you become interested in health and aging?
Great. Thanks, Michael. And thanks for including me on this great panel celebrating the IBH program. So my professional journey began as an attorney. So I went to law school, graduated, and became a corporate lawyer. Really not focused on any particular industry, worked in a large law firm in New York City, and really was exposed to all different kinds of businesses and transactions and experiences. Shortly thereafter, I didn't love it, to be honest. The big law firm life, it was a little bit of a grind, and I was always more curious about the businesses themselves than you could do as a young attorney. I was fortunate enough to go in-house to become in-house counsel for an entrepreneur which was like a petri dish of opportunity, and really stoked my curiosity. When I joined, I think we had about 20 operating companies and a fledgling real estate business. So it really afforded me the opportunity to just get exposure to a wide range of businesses, from real estate to technology to healthcare services. Um, I ultimately transitioned full time to Sandata Technologies, which I had mentioned as part of my bio, which was a software company focused on the home and community-based services market segment, and we developed enterprise software for home care agencies and state Medicaid agencies and health plans. Um, I think, in terms of, my interest in health and aging, it wasn't really until I made that transition that I always understood the value of what we were doing, what Sandata was doing, but it never fully clicked to me. And I think the time that I made that transition was also around the same time that we had our first kids, and my parents, my wife's parents, they became older and more reliant on healthcare services. And so the idea of, you know, needing and delivering value to this population really started to resonate with me. And I think in terms of, how did I get there? It was really just staying curious and open-minded, and really just, like I said, this, like I wanted to learn. There was so much I felt like I didn't know. And I just really put my nose to the grindstone, worked my butt off, and some of it was opportunistic, and some of it was strategic. But I certainly didn't start my career thinking that I was going to end up being in healthcare where I am today.
Yeah, well, it's interesting. I have a similar kind of story because I had no idea. I didn't know anything about health before I got into it, and I was interested in the law and politics and other things. And I'm reminded of, the old saying that luck is when preparation meets opportunity. So I think it's really good for our students to know that they don't necessarily have to have it all figured out in advance. Just, keep working hard and pursuing interesting opportunities.
Yep.
That's
And I'm
great.
still figuring it out, by the way.
Aren't we all? Matt, could you kind of share with us how did you end up here, and how did you end up sort of focusing within this field?
Yeah, absolutely. Happy to. Thank you for having me today, Michael. Um, so I graduated from Lehigh in 1994, College of Arts and Sciences, with a degree in sociology and social psychology. Um, I'd say midway through my Lehigh experience, I wasn't really sure where I was going. I mean, sociology, social psychology at Lehigh, surrounded by a lot of engineers, business majors, and I was trying to find a path. And I think the one thing that was clear to me was I wanted to find a business track that also had, I would say, more of a purpose or ability to serve society, to do something that would help people. So I had a mentor who happened to be an uncle of mine who was in hospital administration, and he said, "Hey, on one of your fall breaks, your pacing break, why don't you come up and take a look at what I do every day?" He was a president of a large health system. Spent some time looking at that. And upon graduating from Lehigh, I decided to go to George Washington University and get a master's in health services administration. So I had, at that point, I think, found a track that would give me the balance of business and impact on society. Pick GW, really interesting. When you look at master's programs, there's some that are all coursework, and there are some that actually integrate a residency, kind of like a medical residency. So GW had what they called an administrative residency. So I did my coursework over about 18 months, and then had a requirement of a 12-month administrative residency. So from DC, I ended up spending the next year in Buffalo, New York with the Millard Fillmore Health System under the supervision of the CEO. And I rotated literally, I would say, from the boiler room to the operating room. I mean, whether it was facilities management, budgets, running the ORs, I got great exposure into healthcare and the concept of a big, large delivery system. So that was kind of my launching point. At that point, I think I knew healthcare and health services administration and hospital administration were certainly of interest to me. But like Ken said, I didn't have it all figured out. I was still trying to figure out what I was passionate about, where there were opportunities. And it was clear that hospitals were integrating, systems were merging, people were seeking. It's kind of funny that I say this at this point because I think the themes are very similar today. Efficiency. It was all about efficiency. How can we do more with less? How can we drive efficiency into the system? And what was really interesting to me as I cycled through my rotations in my residency was kind of finance and managed care contracting and the funding of healthcare. Where do the dollars come from? Commercial payers, Medicare, Medicaid. And that took me post my residency to a company called Multiplan. And if you look at the back of almost any insurance card, Multiplan negotiates and builds networks for all the large insurers, a lot of large employers. So I got into contract negotiation, managed care contracting. That was a great experience, eye-opening experience, but it was very much on the business side of the equation. And I wanted to get back more into kind of, the healthcare side, the delivery of care. So I slowly, over the next couple of years, transitioned back into, I worked at Mount Sinai, I worked at St. Vincent's Medical Center in New York City. I spent many, many years in New York City with different health systems. But it became clear that home and community-based services, the movement of care out of the acute care setting into the community was where there was going to be a lot of energy, traction, and excitement. And that's where I've spent probably the last 15 plus years. So.
Well, and I love that too, because, in addition to being able to sort of explore different avenues, I mean, you began with a kind of broad passion, right? You knew you wanted to combine business with something that was going to contribute to society. And I do think that's one of the interesting things about the new IBH program and about a lot of our focus is it combines those kinds of passions in ways that are, if not unique, it certainly provide a lot of interesting opportunity. And I also just love, both of you so far talking about how you're still exploring and learning and finding new paths. So, Tony, could you share with us sort of how did you end up here?
Sure. Well, great to be with you all. My story is somewhat similar to Ken and Matt. Just a quick commercial for IBH and the College of Health. My guess is there's a lot of undergrads on this webinar, and at least when I was your age, when someone just talked about healthcare, all I thought about was clinicians, people who provide care, doctors. That's what we see on TV. That's what we see in movies. But what you're seeing, at least on this webinar, is there's a whole industry and business in combination with engineering and policy that is directly or indirectly related to the provision of care, but is non-clinical. Just some stats. There's almost 24 million people in the healthcare field, which is the fastest growing field out there. And I say that just to kind of make everybody aware that, within the College of Health and this IBH program, there are countless opportunities outside of just wanting to go to med school or become a nurse. Not that those aren't wonderfully important and meaningful occupations and vocations, but and there are tons and tons of Lehigh alumni. You're seeing people right on this panel that have a non-traditional healthcare background or engineering. I'm from the Arts and Science College that have somehow found their way into the business of healthcare. And the last point before I get into my career is, I will say, listening to Matt and Ken, aging and taking care of seniors may sound uncool or unsexy, but it's the opposite. I think you heard Matt say it. To me, it provides the perfect balance of what I call head and heart. And I think a lot of people are looking for that balance, which means it requires an intellectual rigor, a curiosity, a motivation, a willingness to work hard. But at the end of the day, when you go home and put your head on the pillow, you want to feel like you're doing something good. And whether you're a clinician or doing what I heard Matt and Ken does, and you'll hear what I do, we are indirectly all part of the system. And at the end of the day, there is a consumer or a patient or a recipient of care who is better off based on what we're all doing. So getting more specific, like Ken, I kind of stumbled into healthcare, and I think that's an okay thing. When you're 19, 20, 21, you do not have to have it figured out. My career has taken on many different zigs and zags. Like Ken, I went to law school in Manhattan. Started out for about 6 years working at large firms doing M&A transactions, some of them in the healthcare services space. And, my first word of advice is every opportunity you have in the professional space, or even just indirectly, whether you walk into a restaurant or meet somebody, is an opportunity to impress. And my guess is Ken went to the business side after probably working with a client and impressing them. They said, why don't you come work for us? And that's exactly what happened to me. Is I worked on a deal, met the principals at a private equity firm, and they had a healthcare business. Said, why don't you come work for us? And kind of didn't know anything about healthcare at the time, and kind of the rest is history. Just more specifically about some of my healthcare experience. I've been doing this for more than 30 years in the aggregate, but 20 plus in the healthcare space. A little different than the two of them. I started out on the health insurance side. And when people think of health insurance, that has a negative connotation, especially since the United Healthcare CEO issue. And so we underwrite the risk, right? So the consumers all have insurance either through their employer. If you're older than 65, you're part of Medicare and you get it through the government. The government provides two forms of Medicare. One is right from the government, but they also set up a privatized Medicare, which is what I was involved in. And so we provided health insurance for seniors. We provided prescription drug plans known as Part D under Medicare for millions of seniors. We provided accountable care organization services for seniors. We provided long-term care insurance policies for seniors. But the main goal of what we were trying to do, even though it was a for-profit industry, which we were not apologetic about, you really do well by doing good. And what I mean by that, and all three of us probably can attest to this, when your ultimate clients, meaning whether it's your insured or the person you're taking care of, is healthier, and you've done more to make them healthy, seen them more, taken emails from them, at the end of the day, they're more likely to consume less services and the cost of that care goes down. And so while we were an insurance company and we cared about the ultimate cost, we first and foremost cared about providing the best quality care. And I think sometimes that gets lost in some of the conversations. I ultimately we sold that business to another strategic partner. And then about 8 or 9 years ago, I was looking around, and what I was looking for, and what a piece of advice is, when you think about an industry to go into, one of the things I like to think about is something growing? Is it flat? Is it down? Is it downward? Or is there a growth profile to it? Almost everything in our space, in healthcare services, in healthcare, is growing based on just costs keep going up. The demographic shift is aging, as you heard about. And so that is a great place to be. The other thing I would urge people to think about is find something that provides that interest. Find something where you think there might be a problem, an addressable problem that needs a solution. And one thing I always ask people is the following. I ask folks, how important is healthcare to your overall quality? You've got entertainment, you've got friends, family, sports, fitness, and it comes out that healthcare is pretty damn important. If you don't feel well, generally nothing else is going great in your life. But then I ask people, well, how are your interactions with the healthcare system? And even my guess is many on this call or participating haven't had as many interactions with the system, but we all know the system because we're all consumers of the system. We've all walked into a doctor's office, been handed a clipboard to fill out that kind of annoying form. We've all had trouble and delays getting appointments. And we look at other businesses like, say, DoorDash or Amazon or Zoom or Venmo, and we say, wow, these are amazing. But rarely do I ever hear people talking about how innovative and amazing healthcare is. And so what got me excited when I got into this about 20 years, the same questions were being asked. There was nothing really innovative going on in the margins as we see in some of these industries. And so if you're young and an undergrad or even a grad student or even a professor, I think there's just an amazing, amazing opportunity to help us make what is probably the most important thing that affects all of us even better. And so the last piece of my puzzle is I got into the home and community-based services business, just like the other two speakers, about 8 or 9 years ago. that is providing care in the home, generally to seniors, a very fast growing industry. We grew that business over an 8-year span, and ended up selling it to a private equity firm about a year and a half ago. And now I am trying to help small businesses figure out their path on a strategy, doing healthcare investing and doing consulting services on an M&A basis. So I love the space, and this is a great panel. Look forward to the rest.
Well, thank you, Tony. Yeah, it's interesting. So many thoughts come to mind listening to the three of you. I'm working on a book right now with one of my colleagues in political science, Laura Katz-Olson, focused on nursing homes. But of course, we know that home and community-based services are the sort of big growing area. If you think about all those people 65 and over and 85 and over, most of us want to remain in our homes or at least in our neighborhoods. And so it is an amazing space to think about how you can help and sort of grow opportunities. As I also listen to the three of you, it's really quite interesting to hear your backgrounds, right? A couple of people who went to law school, clearly training in the social sciences, in finance, in management, and policy, right? So you're really kind of spanning the globe, if you will, of a lot of the undergraduate majors here at Lehigh and a lot of the things that we're focused in on. But I'd love to hear your reflections a little bit as you think back. Think about what you've done in your careers, but thinking back to your time as an undergraduate or maybe in graduate or professional school. What did you learn back then? What sorts of skills that did you develop that you found and still are finding useful today as you've gone into these fields? So again, start with Ken. Any reflections about that?
Yep. Thanks, Mike. Yeah, it's funny. As you were asking the question, I feel like this is a little bit of therapy. But I think even when I was going to college, I didn't know what I was
charging later, just so.
Yeah. I applied to college not really sure what I wanted to do or even what the right college was for me. Ironically, I was enrolled at Lehigh and then at the very last minute took an extremely hard left turn and went to the University of Arizona. So I'd say the first 18 months of my collegiate career was exploration outside of academia. And we can kind of leave it at that. I ultimately landed on history. I really enjoyed sort of history. So like Tony and Matt, kind of, in arts and sciences, a liberal arts degree, which, I think for me, history was something tangible, something that you can really like critically analyze and think through and let it somehow be a predictor of the future, or at least teach you, what mistakes were made and what not to make on a going forward basis. And it ultimately was a really good foundation for me to use in law school because it's a lot of reading, it's a lot of analysis, it's a lot of writing, and law school kind of honed those skills around identifying problems, identifying what the core issues are, and then using regulatory and legal frameworks to really analyze those issues and come to some sort of conclusion, whether it was a business conclusion, legal conclusion, whatever the issue is. But it really kind of like honed my critical thinking skills, which I find to be pretty invaluable. I today still, when I approach a problem, think back to some of the frameworks that I was taught in law school about, like what is the real issue here, right? I find a lot of times, you get into discussions and, big debates over what is a problem, what's really going on, and a lot of times people focus on sort of surface level problems or the outputs, but not really digging deeper into to truly understand like what is the root cause of something. And Tony, when you talk about looking at our healthcare system and what's changed over the last 25 years, and in many ways nothing, because are we really focusing on resolving the core issues that are undermining our ability to deliver better, higher quality, more efficient healthcare? So those are the things that when I reflect back on undergrad and law school that I still carry with me.
That's really interesting. I think you make a great point about the need to spend a little bit more time really figuring out what the problems are and defining them. Of course, a lot of our students want to jump right into solutions, and we love that, right? We like the idea that they're interested in not just describing problems in the world, but trying to develop solutions to them. But you're not going to be very successful at that unless you, do some careful analysis and really figure out what's going on. Matt, how about you? And before I let you go, I just want to jump in, remind all the folks who are participating online, we would love to hear your questions. And again, if you are a student, please identify yourself as a student in 20-25 minutes or so. Once we get through our opening conversation, we're going to try to turn to questions from the audience, and I want to give priority to students. So if you have any questions for us, please type them in to the Q&A session. But Matt, why don't you take it away? What sorts of things do you recall from your own educational experience that are still kind of helping you today?
Yeah, absolutely. Thank you, Michael. I think building a little bit on what Ken was saying, like critical thinking, critical decision making. I think when I was in school, it felt painful. I felt overloaded at times. I said, man, they're really sticking it to us. But you're developing a skill set, and it's really, how to process information, how to analyze different problems, and how to really go deep on solutioning and thinking outside the box. When I think specifically back to my undergraduate experience at Lehigh, my degree in social psychology, I was a sociology, social psychology minor. And I look at the time I spent kind of studying interpersonal behavior, interpersonal communication, and the translation of that both to kind of the internal work I do inside the four walls of the companies I've worked at with my peers and my colleagues, the ability to communicate and relate and understand. In my role, I'm externally facing. I work on strategy. I work with payer partners. I negotiate. So there's the relationship building that happens there, and understanding what are their pain points? What are they solving for? How can me and my role and my company help them solve a problem that differentiates the services we offer? And then once you gain alignment potentially externally, how do you translate that internally to the people maybe downstream of me doing that work? How does this deal make sense? How do they implement it? How does it make sense for a nurse in the field doing something? How does it make sense for a client that we're serving? And I look back at the social psychology components of my education, and I think the ability to communicate, the ability to listen, the ability to kind of understand people, work alongside people, I think has paid dividends for me. And I didn't know that. I never had the sense that body of work, that body of academics would impact my professional career in the way it has. I think, business development is a huge component of what I do day in and day out. And it's about relationships, finding win-wins. What matters to my partners, both internally and externally? How do we help each other? We are not adversaries. You heard Tony talking about the insurance companies, and there's a lot of people internally in the industry who would say, man, big bad evil insurance company. Well, Tony also mentioned they hold all the risk. They signed up to manage this risk pool and pay the bill. So the better I can do as a provider of healthcare services in building that relationship, understanding the risk that they're exposed to, and what can I do, in the day-to-day functions and services we provide to help them succeed, that ultimately makes us successful. But I look back on social psychology, sociology as really playing a big role, and I think the development of maybe my people skills, and that's really played out throughout my career. So,
Yeah, I want to go to Tony next, but before we do, I just the answers from Ken, Matt, really instructive, right?
Yeah.
You pointed to history, you pointed to social psychology. People are sort of coming into a webinar on business and health. They probably were not expecting those responses. I'm kind of curious. You've both hired people. You've hired lots of people. You've been in those sort of rooms making decisions about who you need on your team. How do you respond to someone who has studied in those fields, for example, or taken those kinds of classes? Does your own experience lead you to think, yeah, give that person a shot? Maybe it's a non-traditional path, but they might still have something to bring to the table. Either any of you want to jump in on that one? I'm curious.
I'm happy to jump in. I also served as head of human resources or chief people officer for about 30 years under my organizations. And it's a great question, Michael. If you're young, you probably think, well, I have no experience. How am I going to get hired? I have come to believe that incumbency often is a detriment. And part of the reason why we are, quote unquote, stuck, I talked about some of the challenges, is because we're so focused on incumbency. And so I am all in on looking at soft skills as being almost more important for experience. Obviously, in certain roles, it doesn't lend itself to all roles. I'm looking at Matt and Ken shaking their heads, so I think they would tend to agree with that. And so, the lesson to those out there, and one of the unique things about what's going on at Lehigh today, it seems to me, I'm on the Lehigh College, the DAC, which is the Dean's Advisory Council for the College of Health. And what is going on at Lehigh that is really unique, and it really didn't exist when I was here, is what Lehigh is teaching is they always taught the soft skills, right? And soft skills are as or more important than what I'll call hard skills. What I mean by hard skills is substantive. Do you know Excel? Do you know about healthcare economics? Do you know about how to take risk in value-based care? Do you know how to code? Soft skills are, do you work hard? Do you have resilience? Are you likable? Do you have a good attitude? Do you show up on time? And candidly, my own experience, people ask that question, well, how did Lehigh set you up for success or for your career? And if I'm honest, it's, I say kind of sort of, and that's not a negative. They taught me the soft skills. There is no substitute for working really, really hard and getting out of your comfort zone and then finishing a project. And I promise you, when you look back in months or years, you're going to be really proud of that effort, even if it doesn't go as well. But what seems to be going on today inside the College of Health with this IBH program, and even just, straight College of Health, is not only are they teaching the soft skills, but they're also teaching hard skills. And those hard skills around healthcare are in very, very short supply for our youth. I did a lot of hiring, and for the same businesses that Ken and Matt are running, it is almost impossible to find 21, 22, 23-year-olds who understand the healthcare landscape, how the money flows, how are services provided, not the necessarily clinical aspect, but the business of healthcare. That skill, how to analyze claims data, how to look at a series of information, healthcare data, and kind of draw conclusions so we can then act upon it to try to provide better care and lower cost. And so, had this new group of students been present, I think we'd all jump on the opportunity to kind of seize and hire lots of these people. And so, I'd love to give that advice. You can take it or not, but I would really encourage, the undergrads to take advantage of the soft skills. My main memory is some professors I may have met, and going out of your way to kind of spend time with them, meet as many people as you can, get out of your apartments, get out of your dorms, get out of your fraternities, get off your phone to just meet people. Your network is going to turn out to be one of the most important things in your career. And the more people you know, the more opportunity that presents. And then just on the substantive side, learn as much as you can about, just general healthcare and the business side and economics, the money flows, how people are paid, provider contracting. I think there's a bunch of biostats classes, population health. I can tell you what they're teaching at Lehigh does not exist at many other schools. And there are tons and tons of employers out there who desperately need those skill sets.
Well, it's great to hear that. I mean, one of the things that we did try to do in designing the IBH is sort of combine those core business courses with classes in health policy, health finance, health economics, because we think, it is critical for students to understand that. Years ago, when I was teaching classes to medical residents. They asked me to come in and talk to them about healthcare systems outside the US. And the easiest way to explain the French healthcare system is to say, well, it's a lot like the traditional Medicare program, but not restricted to older people. I thought that was a great opening. And I got a whole bunch of medical residents who were working in the healthcare system who were giving me a blank stare. And I realized no one had ever taught them how the Medicare program works. I'm like, hey, you guys might want to figure this out. Who do you think's paying you? So it was an interesting realization for me of just how important that knowledge is. So my next question for all of you is, we have a lot of people who are worried, right? They look around at what's happening with the economy. They look at proposed cuts to Medicaid, Medicare. They think, oh no, it's a bad time to go into the business of health or aging, right? Will the opportunities be there? And I'd love to get your perspectives on this. Where are the opportunities? I know it's always predictions are dangerous, especially when they're about the future. But you don't have to. None of us are going to know what new technologies will exist 10 years from now because we probably haven't thought of it. But when you sit kind of from your current perch, where do you see the job opportunities, the career opportunities within the fields of health and aging? Again, Ken, I'll start with you.
Yeah, so I mean, I would say from my perspective, and again, hearing from Matt and Tony and the trajectory of our careers, the opportunities are much broader than I think people would typically think when they just think about healthcare. Right? It spans far beyond healthcare services. And the good news is, I think it's good news, at least for getting into a career in healthcare or business in healthcare, is right, Mike, you pointed out, at least, the number of people over the age 85 is rapidly growing. I was at the UN celebration of International Older Persons Day last week. So this is a worldwide issue, first of all. So I'd say the opportunities are not just here in the US, the opportunities are global. And the number of people, so they measure it starting at the age of 60. So today it's 1.2 billion people, projected to grow to 2.1 billion over the age of 60 by 2050, so in another 25 years. So the market opportunity is also staggering, right? If you think about it just in terms of business terms, like total addressable market. So that means that in all different ways there are opportunities to impact the lives of aging people, right? It could be traditional clinical services. It could be regulatory, right? I mean, we have a regulatory framework that is arguably broken and doesn't have the right incentives in place. So there's public policy things. There's administrative, right? So Tony, myself, Matt, we're more on the administrative side where where we're assisting organizations improve how they're delivering clinical services. There's not-for-profits that are just advocating for health services for individuals. I think the more interesting ones are, think about in technology and AI, and I saw a question come across on AI, which I imagine we'll get to later, but, how can we leverage some of the new technologies that are out there today to really touch more people, deliver better care, even in engineering, right? I mean, we have something that I've talked to some of the professors at Lehigh about is, that there's a workforce shortage, right? I mean, it's just simple math. You have, 1.2 billion people that are over the age of 60. There's not enough caregivers in this world to take care of all those people. So I think robotics is a big opportunity. So, and then the last thing I'll point out, and even something that opened my eyes on the mobile health side, is we have many customers that are sort of like ancillary healthcare services. So these are the partners to hospitals and other health systems that are providing food services or laundry services or other things that, I forget who said it, that, just we all take for granted that happen every day, but have an impact on the healthcare system. So I think the opportunities are limitless, and it's really just about keeping an open mind and finding something that you're passionate about. And like you said, Michael, a little bit of luck, right?
Absolutely. Yeah, no, as I said, Dr. Butler always said, you're in a growth industry. And the other thing that you talked to, thanks for mentioning the UN and the global nature of this. One thing that people I think still get wrong sometimes when they think about lower income countries, for example, or middle income countries, they think of them as younger places, but a lot of those countries are aging even more rapidly than we are in the United States. So it really is a global phenomena. And the other thing I thought of while you were speaking is, yes, we have lots of people 65 and over, or 60 and over, if you're using the UN sort of cut point. But all of those older people, also, a lot of them have children. We've known about the so-called sandwich generation for a long time, women who are providing care to an aging parent or spouse and their children at the same time. My mother and mother-in-law are both in their 80s, and my wife and I are experiencing this now as they need more and more help from us. And so that's another really interesting dimension of this, of where the sort of demand for this kind of help, especially all of you at various points in your career have been part of the, home and community-based services field. So it is interesting to think about that life course perspective on all of this and who you're helping along the way. Matt, how about you? What are your thoughts about opportunities?
So endless, limitless. Let me just start with there is so much opportunity in the system to do more than we're doing. I think the challenge and the headwinds we face, when I think about, you mentioned Medicaid cuts and pricing pressure, is the dollar has to go, further. It has to go, be used more efficiently. We spend a lot of money per capita in the United States on healthcare, and there is definitely a strong argument that we haven't done it as efficiently as we should. So that said, I mean, the things that jump right into my mind, Michael, are population health and data science. And I would say we know a lot about population health, and we know that there's a lot of correlations that lead to disease for all of these aging people that we're trying to take care of, in the community in a more efficient way. But we haven't quite gotten it right. Like, we can sit around and say, we know that somebody born in zip code A versus zip code B um, is gonna, live 20 years longer or 20 years less, and they could be about 3 miles apart from each other. So we know a lot about why people are costing the system a lot of money. What we haven't totally solved for is how to fix or, drive some efficiency into those problems. So I think understanding population health, if I was a student, would be really, really important because, having spent a lot of years in this space, I look at that as the big opportunity. I think a lot of people are trying to get that right. We talk about, social determinants of health, a lot of buzzwords, but what levers can you pull to affect some change? And I think the second thing I mentioned being data science, there is so much data on all of this. There is a tremendous amount of data being produced, created, captured. Is it captured in a consistent way, a consistent language from EHR to EHR, from my home care system to your home care system to the insurance company to claims data? How do you grab the data, analyze the data, reconcile the data, figure out if you've been successful driving more efficiency into the system? Those are like limitless through my lens. It is like, man, those two buckets alone, you could probably have a long, long career and a really successful career if you got traction. So I would call those out. Pop health. I know you guys have classes, you have faculty. I would really take a deep look at what does that mean? What do we know? How can you bend those curves? And then I think data science is going to be incredibly important. And we could get into AI. I could tell we're doing a lot of talking about AI. I saw some questions as well. We can do that later. But yeah, data science, AI, pop health. I think those would be great spots to put time and energy into. But then, you got to work hard, as Tony said. You got to get out there and work really hard. Put your nose to the grindstone. Did we lose Michael?
I think we lost Michael.
I have. So I'll just jump in
Go ahead.
and echo. I'm as bullish. If healthcare was a stock, we'd all be long, right? It's endless. We talked about the jobs. It's the fastest growing sector of any sector in terms of employment. You know, Ken, you mentioned the size. I think just in this country, we spend about $5 trillion a year, 2 billion of which is, the government, Medicare and Medicaid. Think of that, $5 trillion. And we always used to talk about if we could just do 1% better, so find 1% efficiency, that's $50 billion. These numbers, when politicians or people just throw out numbers, they kind of get lost. And so I like to kind of bring it down. So 1% of that is $50 billion, which is the entire size of the Pennsylvania budget. So just think about, could we be 1% more efficient? We've all interacted with the system and seen probably some inefficiencies. Imagine if we could get 10% more efficient, how big these numbers get. And because the healthcare costs are growing at about 5% per year, there's a lot of talk about inflation in the last several years. 5% is an enormous number. And so that 5 trillion at 5%, that is not sustainable. And so there is, Matt mentioned data analytics. There's all this data being collected in different silos. Do we have the right people that are actually looking at it, analyzing it, getting it to the right place at the right time so that someone could take action? I think all three of us spend a lot of our careers caring for people in the home. The home is an increasingly important place where people want to spend the last X number of years. They don't want to necessarily be in nursing homes or senior housing. COVID has had a big impact on that. One thing we used to always say, we have human beings taking care of it in there, but imagine if we could capture all the data of the eyes and ears of the other people in that and collect that data and organize that data and spit it out to the right people so that they could take action at the right time. We talk about a healthcare system and people use this term. Is it really a healthcare system or is it a sick care system, right? We all pick up the phone and call our physician when we're sick, but there's kind of a running joke that Google, or maybe now it's ChatGPT, they know when someone is ill before they make that phone call based on just Boolean searches of, hey, my head hurts in my chest, I have pains in my chest. And so it's kind of funny and anecdotal, but there's some truth to it. And there's a real opportunity in finding people who know how to use massive data sets and use that information. Just some other opportunities, because when I was your age, and even, when I talk to young people, I don't think people understand the breadth of opportunities within the healthcare space. I've mentioned most people think of it as clinical. All three of us are on the business side of it. But if you look at almost every major organization, candidly, in the country or in the world, the healthcare expense is one of the largest line items in their P&L, whether that's providing health insurance, the lost productivity they get for people being sick or out of the office. Think of all the big companies. Uber has a giant healthcare arm. They send out specifically targeted at seniors. Apple obviously is in the healthcare business with their Apple Watch, collecting healthcare. So what are they doing? They're collecting healthcare data on this device. And now the next step is, what are they going to do with that data? How valuable is that data? They talk about data being the new bacon. Right now, the data is just sitting inside of the watch or inside of Apple, but are we really leveraging that data? Obviously, Amazon's in the healthcare space. They run a pharmacy. Every big organization has a healthcare arm. Walmart, all the retailers, Target, Walmart, Walgreens, Rite Aid, all are in not only the delivery of shampoo and Band-Aids, but they all are in the business of now delivering care and trying to take a slice out of that. So, in short, you all should hopefully feel really good about your choice of being a part of this college and this program, and the opportunities are really endless.
Thank you for saying that. And I am not Beth Dolan, but I am apparently playing her on this webinar because I kept getting booted off. So I quickly ran down the hall and she has graciously given me access to her computer. So sorry about that, everyone. I thought we would shift gears right now. We've got a couple of questions. Ken, you mentioned one earlier. We have a question about AI is the buzzword of the day. And of course, as we know, it's 2025, so every sentence has to contain a noun, a verb, and AI. So we may as well jump in. The question is how this was being addressed within IBH. And so, Ed may want to rejoin us if he has some things to say about that. But I'd start with each of you again, starting with Ken. How are you getting incorporating AI into your work? How do you imagine this might contribute to some of the things the three of you have been talking about, the need for efficiency, the need for analyzing a mountain of data, for example?
Yeah, I'll say, AI is obviously the hot topic of the day. Um, I think because I have or come from the technology background, I think in some ways AI is just another name for a lot of things that have been going on for a long time, right? So, Matt talked about data analytics, pop health, right? Like AI doesn't work without the data. And for many, many years, organizations in healthcare have been using data to make better decision making. So really, the way I think about it is the AI that we know of today, which is built on top of the large language models, is really just creating a different interface and getting access to that data and decision making to the masses, and doing it at a pace that is far faster than traditional AI was able to do. One example, so Care Connect, my startup, it's an AI startup. It's about 8 years old, so predates ChatGPT and Gemini and Claude. And essentially what we did was we took caregiver compliance and schedule information across a large number of disparate databases across different systems, and we normalized it to create a single caregiver record, and essentially built an AI generated matching algorithm that matches the most qualified, lowest cost available caregiver to work inside of a provider organization. And the problem being solved, which Tony and Matt, I'm sure, can appreciate, is that these caregivers making $20 an hour are working for 2, 3, 4, 5 different providers at the same time. And so every provider is managing the compliance of that individual, is managing the schedules of that individual. And so the intent is to create a portable record that could be used across the different agencies, or provider settings. So, again, so in my mind, AI has existed. Today, the development of the algorithms is just a lot easier, right? Access to the data, you normalize the data, but then, through a simple, almost like a Google search engine, you can search that data and just return that caregiver instead of having to build a lot of what we had built 8 years ago. So I think it's going to help transform and accelerate. I think the other thing, and then I'll let Matt and Tony weigh in. The other thing that I see is it's really it's AI assisting clinical decision making, right? Right at the point of care. So interpreting clinical data and helping a provider make a better decision or a faster decision, right? So AI is very, very good at that right now. Even AI can sit and listen to a medical visit and transcribe notes, right? So a big pain point for providers is transcribing their clinical notes into an EMR. AI does that automatically for them right now. So I think where we are today with AI is the ability to develop very targeted solutions that will solve some of these bigger pain points that drive efficiency in either the administrative or clinical decision making for providers and other organizations.
Well, in that particular example, also, a fairly significant source of frustration on the job for clinicians and the feeling like they can't focus on their patients. I think what's interesting, and then I want to turn it to Matt and to Tony to get their reflections on this, the two examples you gave aren't really a matter of replacing people with AI. It's actually, in some instances, may provide additional job opportunities, I would think. So, Matt, your thoughts?
Yeah, I think it's going to provide additional job opportunities. I'll just start by saying that. I think there's a lot of fear out there about AI and the replacement of jobs. I think the sooner you lean into it to drive efficiency, the better. We made a decision as an organization probably a little more than 2 years ago to start getting really serious about this. And we've done everything from build some stuff, which I'll tell you about in a minute, which I think is some cool stuff, to also just educating our employees on how to utilize these tools to be more efficient in their roles. So I would say to the students out there, absolutely embrace, challenge yourself with, what can be done differently, kind of channel those themes, those data set questions we were talking about. What data could you push through? How can you use this more efficiently? To get more done and be more productive and see the downstream impact of all that. So internally, we actually went out, found a company called Glean, and they overlay their AI technology on basically our Outlook platform. So I actually have it open on a separate screen over here. And when I go into my Glean, platform, it literally knows everything I've been doing. Like it's got my calendar. It knows I'm at the Lehigh Colloquium right now. It knows what documents I've been working on. It knows what documents and emails I've received. I can ask it to summarize all of the emails from somebody in the organization who I've been corresponding with over the last 30 days. Could you please take all of those emails and let me know what the themes are, what the deliverables are? Boom, it's done.
If you could ask it why Zoom kicked me off, that would be
we could ask it that. What was Michael's problem? It might know. You can do things like, in my role, contracting, I could say my pricing goals, my strategy, target pricing strategy is in 3 years related to this individual account. We are here today. This is the volume. These are the services. Do you have a strategy to get me there? It will take every strategy document we've done and literally take the best thinking and synthesize it right down. So I would spend a day or two working on what's my next move? And this thing will get me 85% of the way there. It's not replacing the work we do. It's just making the work we do more efficient. And I recently had somebody say it's kind of like, a calculator. Like we all use calculators, right? You have one on your phone, you pull it out, you can do the math, but the calculator makes the math go a little quicker. So it's not replacing your ability to do or understand things. It's just driving efficiency into what you do daily. So,
although I still do enjoy long division.
Exactly. Yeah, here to stay. I think if it's going to move quickly, I think it will drive efficiency into the system for sure. And I think I'm thinking more administrative business world. When you get into the clinical world, it is really, really interesting. As Ken was saying, just even documentation of notes and checking, reviewing, auditing documentation. It's really powerful.
Great. Tony, any reflections on AI?
Yeah, I would echo both of them. I would lean all in. I don't view this as a threat. There obviously are a ton of issues. We did a whole panel with, I think, the board at a dinner at Lehigh about a week ago. There are certainly some negatives, but there are way more positives in terms of AI. And so, if I were an undergrad, I would be spending, at least an hour a day on just playing around with these tools. But it's also important that we don't lose sight of what it means to think, because, can AI be creative? And, that's a big debate out there. And so, let's not. Thinking is really hard, and my kids are now, older and out of the house, but I remember when they were younger, they'd come home from school and I would say, well, how was your day? And, they would one word answer because it wasn't something they could memorize. They were memorizing for high school and middle school and they had to think. And so, keep thinking is my only, word of advice, but some specific things in AI that I think to me are really, really exciting. Part of why we are where we are in some of the mess of healthcare is we're not really consumers. And what I mean by that is we all go out and we buy food. We pick, do we want to go to Chipotle? Do we want to go to a steakhouse? And we base that decision based on the quality and taste and feedback and price. Same with clothing, but because healthcare was always, it felt like paid for by somebody else, your employer, your parents, you kind of became indifferent. And for a while now, we've talked about consumerism and how do we make everybody have a more vested stake in this. And healthcare is really complex. We're all in the business, and my guess is when we get our claims data from our own family's usage, I'm still confused. And so what AI can do, and I had a recent example with this, it can level the playing field and kind of democratize information and make it bite-sized and put into real life context and make it digestible and knowable so that we can act appropriately. So a classic example, I had an MRI and someone sent me the results. It's in medical terms. You just throw that into AI and it says exactly what you can do. When people leave hospitals, they get discharge instructions, but they also forget what the nurse told them when they leave, and now you can type something in and figure that out. So I believe it's gonna massively increase compliance, and we have a massive compliance. Just we're all in the aging world, and so as you get older, you start taking more and more pills. Some people take 8 pills a day, 9 pills a day, even more. And I'm only 58. I take a couple and I forget sometimes. So imagine if you're 85. And we've been struggling with medication adherence or medication compliance for years. And if people just would take the drugs they're prescribed, the theory is they'd be healthier, they'd stay out of the emergency room, costs would go down, and the world is a better place. And so how can we force that compliance? And AI, I think, is going to go a long ways to helping that. Just to echo something Matt said about data, there's all this data in the world, and we've been using data forever. Ken's right. It's nothing new. These learning models are new. These training models are new, but there's always been systems on everybody's organization that has data. The issue sometimes is that data doesn't always talk well with other data. Sometimes it speaks different language. Sometimes there's territorial rights. It's interesting right now. You go to one hospital and then you go to a different hospital and you say, well, why can't they share my imaging, my radiology imaging? And yet they don't. Why isn't it all up in the cloud? I think AI is going to accelerate the demand for things to talk better to each other so that we can draw inferences and draw conclusions. And I think at the College of Health, your biostats classes, your epidemiology classes, your basic economics classes, learning to use Excel, all of those things are kind of hard skills that I think are going to give you all a head start in kind of capturing this AI usage and making, trying to put at least a dent in this cost and quality issue that we've all talked about.
Well, it's interesting too, when you talk about pharmaceutical use, I can imagine AI contributing at two ends of the spectrum, because on the one hand, you have adherence, right? Are you actually taking the drugs you've been prescribed and doing it on time? So all sorts of built-in reminders and algorithms that would help people with that. On the other hand, speaking of Dr. Butler, thinking about him a lot today, he was a psychiatrist. And when he was in clinical practice, the first thing he would do was have his patients come in and say, put all of the medications you're taking in a brown paper bag. And he said, 75% of the time I would take them off meds, because the other issue we have, this is true for an aging world with lots of people with multiple comorbidities and lack of coordination within the system, is polypharmacy, right? That could be another thing where AI could, jump in and maybe help eliminate that. Well, let me shift gears. We only have a little bit of time left. We've got a couple of questions. I'm going to try to combine them a little bit. We had one question fairly broad about, thinking about longevity. As you all know, we have lots of projections that will have an increased number of centenarians. I actually think some of those projections are a little bit wrong and ignore biology, but we're certainly going to have lots more older people. And the question is about, how does that shift how we think about aging and caregiving? And then the other comment we have from someone is someone who's currently managing their mother's care while having a teenage child, and this person shared that, I've accumulated a lot of wealth of knowledge about how to manage health and be a caregiver. I'm curious, especially because all of you are in the business of home and community-based care in one way or another. Do you see opportunities for caregivers to learn from each other, right? How can they share that knowledge? Because as we all know, certainly when you've had some experience doing this, you do learn a lot along the way. So let me just shoot out. I'll start with Ken again, just kind of broadly as you're thinking about the sort of rapid longevity, not just life expectancy increases, but increases in longevity. How does that shape your thinking about caregiving?
Yeah, I think the longevity question is particularly interesting, and a lot depends on what we mean when we say longevity. I would say my wife and I, we spend a lot of time talking about longevity. She's way more into it than I am at this point. But I think at least the way we talk about it is really prolonging our quality of life as it exists today for as long as possible. So it's not necessarily just about living longer. It's about living better for a longer period of time. So if we just, I'll arbitrarily put a line in the sand and say, if 80 is like a cliff to where, sort of quality of life starts to decline, how do we push that to 85 or 90? And so at least if I think about it and define it that way, we're deferring our demands on the health system a little bit longer, right? I mean, like no doubt we'll have some conditions that are going to need some medical treatment during that period of time because the body just starts to deteriorate. But I think if we're able to sustain a healthy lifestyle for an extra 5 or 10 years, now we're just pushing the same amount of people into a later period of life, even if we live to over 100. Versus having to support more people in that band that are just living longer. So I think that's kind of how I think about it.
Mhm.
I don't know
Well,
what else.
I mean, and for the students who are listening, if you take my class on aging and health policy, the concept Ken was just describing to you is called the compression of morbidity. We've been sort of documenting this, right? This effort to kind of shrink the number of years you're in poor health to sort of fewer years and push it out farther and farther. Was also, I think, gets back to your comment earlier, Matt, about, why would the private sector be interested in population health? I imagine a lot of people are thinking about it exclusively in terms of CMS or CDC, but clearly all of you were in the private sector and you're interested in population health for that reason, which is fascinating. But your thoughts about kind of aging and caregiving, as we sort of reach this sort of age of increasing longevity, what does that make you think about? Oh, Matt, you're on mute.
Thank you. I was going to say the theme of the day for me is really back to this efficiency. I keep saying efficiency over and over, but with that pop health overlay, right? What is driving population health? Don't lose sight of that. How can we do more of this? And that is the challenge we face today. When you think about, the longevity, the number of people aging in, I can tell you at Biata, we struggle to probably say yes to 50% of the business that comes our way. 22 states, 7 countries, 50% of the business that comes our way, we don't have the resources. So how do we challenge ourselves as a delivery system, right? As executives in the healthcare space to care for all of these additional people. And that I think, is where there's these opportunities. I worked in PACE, Program for All Inclusive Care of the Elderly, for many years, congregate settings. I think Ken or somebody mentioned earlier, you have one-to-one care happening in the community. There's laundry happening, there's meal prep happening, there's shopping happening, Uber, DoorDash, other platforms. How do we drive more efficiency down to care for more people? We are scratching the surface of this. And I think the longevity that we're seeing and the number of people aging in is just going to continue to press on this, because I think we're already at a point where we can't do it. We can't say yes to everybody. We can't figure out how to do it consistently for everybody. We as an organization do a really, really good job. We have lots of people who look at our reliability year over year. But what I can tell you is the demand is outpacing the supply. And without an injection of additional efficiency, technology, creative third-party solutions to help people get what they need, whether that be AI, whether it be, other technology platforms that we've seen be very successful in other spaces. I think healthcare is just like this world of opportunity to do more for more people over time. So
And
I
th-
I
I'd
could
love
go
to.
on and on about it, Michael, but I think there's just for the students, man, like I could see like a million different ideas that you can incubate that would help.
Well, I'd also love to hear your thoughts about this whole issue of how caregivers might share knowledge with each other. I know in conversations that we've had about the work of Beata, you do a
Yep.
lot of outreach and have ongoing communication with the families you serve. Any thoughts about that?
Yeah, I think there's an opportunity, based on the question that was in the Q&A, to begin to document, use technology, use AI, use digital platforms to share specifically. I'm caring for a parent, I'm caring for a medically fragile child. We transitioned from hospital to home. It was important to have A, B, C, and D all line up. Um, I think there's a lot of gaps there today, but I think the opportunity would be to share that information, to document it. That could be a potential venture for somebody to say, we're going to begin to document the best protocols to take care of somebody in the community who's challenged with A, B, C, and D. Um, so again, I think we do it okay today. It reminds me of like nurses changing shifts, even in the house. One nurse going out, one coming in, they hang out, they talk to each other, they transition notes back and forth.
Mm.
But if you're caring for a loved one, how do you do that elegantly and maybe put that somewhere for somebody else out there in the universe who might be facing a similar situation? And, Michael, as you and I have talked about, we at Biata, we specialize in some pretty high acuity stuff, medically fragile adults and children, really complicated stuff. Um, I was having a conversation the other day about, how we get medically fragile kids home from a hospital who are technology dependent. You wouldn't believe the number of things that go into that conversation outside of the clinical. Do they have a generator? Can the electrical system support, in an emergency, backup power? Is the device that they're going to be dependent on, does it fit through the doorway? Do doorways have to be made bigger? Do we need Hoyer lifts? Is the bathroom accessible? Like you can go on and on about there's a diagnosis and a level of acuity, but then how do you translate that into reality? And I think there's people out there like the individual who asked the question who have a lot of knowledge on something.
Mhm.
How we translate that and share it across the system, that's a tremendous efficiency play that could probably be done much better than it's done today.
Well,
Yeah,
thank.
the one thing I'll just add
Okay.
quickly on that topic, I think we're going to start to see some of the larger health systems or people that have this really longitudinal view of the individuals and are also interacting with, the family members, like you mentioned, Michael, the sandwich generation, to really provide, to act as a hub of resources for professional and family caregivers and patients to really understand and get access to the resources necessary to care for aging individuals. I know Northwell Health just last month launched their Aging Institute, and it's specifically focused on that, is to really be a hub of information and services and support for family, professional, and caregivers and patients.
Great. Tony, I'm going to give you the last word. Have you any thoughts that you have about this sort of broad question about the implications of longevity?
Yeah, longevity means different things to different people. I think Ken hit the nail on the head. I read a lot of books, the Wim Hof method. Everyone's trying to, in our age, in our 40s and 50s, how do we stay in shape so we can continue to ski or garden or play sports or hang out with our great grandkids or grandkids in 70 and 80. But what I always come back to is the trends. And the trends are great for opportunity, but a little scary from a fiscal standpoint and a care standpoint. And we've all touched on this. And so what do we have going on? We have a massive demand for services because more people are living longer and getting older. And yet we have a stable or shrinking supply of people who can take care of them. Maybe it's growing a little, but it's not growing at the level. And then you get to a cost perspective, we can't afford to pay for all of this. And so you've got a hat trick of a perfect storm all coming together. And do we have the right people thinking about how we're going to solve that creatively? Robots. No one thought, right now we do everything one-on-one, right? I would take, my dad's 90, he has help. As a human being, comes into the house, takes care. Is that method, is that ratio, is that sustainable? The PACE program was a different model that had, much higher ratios. We need to think about the labor shortage and how we're going to solve that. That gets into politics and immigration. Candidly, I don't think we've ever, Ken's got a software stack that gets at a really, really important issue. How do we make caregiving feel like a real career? These are W-2 employees. They're paid hourly. They work for 3 or 4. Loyalty for them is probably not high up, but how do we really make that a job that is sexy, pays right, can take care of a family, they feel good about it? How do we attract more and more people to that? We didn't really touch on kind of the mental side. We've been talking a lot about the physical side, but we all know, now people say that the mental state of people, particularly in their old age with social isolation and loneliness, contributes 50% or more to the clinical and overall cost. Can AI, which you could talk into AI and it can have a conversation with you. Dementia patients, my guess is all of us, the vast majority of all of our clients have some form of cognitive declination. And, can AI be a source of communication that can at least make a dent into something rather than a human being have to be in there? Robots, I think we're going to have to find a way to, a lot of what we do in the home is unsexy work. We take care of dressing seniors. We take care of toileting seniors. We take care of cooking for seniors, bathing seniors, taking them on errands. Are there ways we can push some of that off into a robot? That sounds like, wow, we're kind of disregarding our main function. I saw one question on there from a person who's caring for their mother also as a young child. Smartly, to me, a lot of states now have what's called these consumer directed programs. So if you otherwise were taking care of a senior, that was often considered uncompensated care. But now a lot of states will compensate that person for taking care of a family member. So if that person's still living and not being compensated, I would suggest you just throw it into a chat GPT and you may be able to get some compensation for that. As far as sharing best practices around caregiving or what else, there are those resources. Specifically, there's something called CAN, the Caregiver Action Network out of DC, that I think does very good work in terms of kind of supporting caregivers and sharing best practices. That's just an observation of one resource that they can look to.
No, that's great. Well, we're running out of time. I do want to remind the students, I got a couple of questions in the Q&A, but fortunately we have people smarter than me monitoring this. If you want to get credit for the 5x10, make sure to take the survey at the end of the webinar. But I just want to take a moment. I want to thank Beth Dolan. I want to thank Ed Gomez. And of course, I want to thank our 3 incredible panelists. I know I've learned a lot. It's really inspiring to hear about the careers that you've had. And I hope our students are inspired to think about what they've learned and to recognize that there are incredible opportunities in health and aging. So with that.
Hey, just one more plug, Michael. I'm sorry.
Go for it.
There's something we're working on over at the College of Health is a directory. It'd be great if we knew, we've got thousands and thousands of Lehigh alumni, but we don't know all of them that are involved in healthcare. And so we're working on trying to, come up with that list so that folks can reach out for internships, jobs, networking, and just career advice. And my guess is, our chairman of our whole organization, Lehigh, Vince Forlenza, used to run Becton Dickinson, and, here's us and so many others. And so there's just a ton of Lehigh alumni that are directly or indirectly involved in healthcare that you never would know about.
Well, and we're grateful to all of you. And if you are a Lehigh alum and you tuned in to learn about the business of aging, please do reach out for us. If you haven't already been in touch, we'd love to hear from you. So again, thanks everyone. Thanks for joining.
Thanks everybody.
Sorry about the technical glitch.
Thank you.
Thanks, everybody.